So ALS is a disease where basically your signal is cut off from, like if your brain is trying to want to do something like move your arm or move your leg, but it's not actually letting you move your arm or your leg. So that nerve is cut off, from transmitting that signal. So like if somebody is trying to speak to you, those words aren't coming out because that signal has died from, coming from their brain, then coming out of their mouth. There's two types of diseases, onsets. There's a limb onset, which means that their legs or their arms were affected first. So whether it be, they might have had lost use of their hands, whether it be picking up little things or driving, things they do with their hands or with their legs. So like one of the symptoms that a lot of times with people have trouble with is walking. So they'll just all of a sudden just be walking and tripping. And so that's another part of the limb onset is when, their legs get affected as well. So then it just kind of deteriorates from there and kind of moves up into their respiratory system. And that's like, the final piece of it is after, it moves into their limbs, whether it be their arms or their legs, then it moves up into their respiratory system, which is their bulbar region. So when that gets affected, the bulbar region up in the spinal region, and so that's where all the respiratory issues come from. So a lot of times what they'll do is called a test called a FVC test, which is test their functional vital capacity. And like they'll blow into this machine and it tests the strength of their diaphragm muscle, which is down here, and that's the whole big piece of the puzzle. So what they do is monitor like the change in their diaphragm from like month to month to month, and that's kind of how you tell, like how fast or how slow a patient is progressing, because life expectancy for ALS patients 2 to 5 years, but as you all know, we have patients that have lived and are living well past that 5-year mark, and that's what we always tell everybody is don't get hooked up on that number, because we have patients that have lived with it for over 20 years, just because it's slow progressing. So we had the two different types of onset, the limb onset, which I just talked about a little bit ago, and then we have what's called the bulbar onset, which a bulbar onset means that their speech was affected first. So they've had problems obviously with talking, or the voice quality has been really low, and so a lot of times when patients will go to the doctor because of that, the first thing that they think of is they've had a stroke, because they talk like a stroke patient. And so they do different testing on them. It's a rule-out process. There's not one simple test that can be done to diagnose an ALS patient. It's a rule-out process, and sometimes that can take up to 6 months to rule that out, depending on how, prominent some of their, factors are that's, going on.
Put a bright light on this somewhere?
Well, there has been a lot done. If you think about this disease has been around for 100 years. And for somebody looking at it from the outside, it's like, why has nothing been done? But if you look back at everything that has been done and how long it takes to get there, because for somebody on the outside, you would think that in a time frame that why can't something be done in a year, but it takes way longer than that, because everything has to go through the drug trials, through FDA, get approved, and that takes years and years and years. Then once they start trying it in humans, then you're talking about more years to see if that even works. But if you think about the things that we have tried, like the Reliotech drug, which is the drug that's out on the market that slows the progression down of the disease. It's obviously not a treatment, but it is out there to help slow down the progression in the patients. But also the biggest thing is the push for multidisciplinary clinics. That has improved the quality of life for our patients, and their patients we have found are living longer because of them being involved in our multidisciplinary clinic, which we have one here, then there's one in St. Louis as well. But with that treatment, with that being involved in that clinic has made a world of difference for our patients and their quality of life.